So welcome, my name is Leandra. Welcome to the Possibilities of Virtual Reality in Healthcare 2022. It's our first webinar for Proven Reality. My name is Leandra and I have with me my colleagues. We've got Pavel, who's our product manager, Dr. Alexander, who's our medical officer, and our CEO Zaid is also here today. We hope that you enjoyed the event, and just a couple of house rules before we start. I see that we're already using the chat. I will be monitoring the chat to see if there's anything coming in there that's important for my panelists. But let's try and keep the chat to the minimum because I don't want to disturb them while they are presenting. We will have a Q&A session. We've tried to keep the webinar not too long. It's 30 minutes because we know these days, time is precious. So 30 minutes in, there'll be a nice Q&A session at the end. So keep your questions for later, write them down. If you want, you can write them in the Q&A and Pavel, Dr. Alex and Zaid will be able to answer them at the end. But yes, you will have that. So try not to put the questions in the chat. Just if you see at the bottom of the Zoom, there's a Q&A part where you can actually just write down your little question for them. But without further ado, I'm going to hand over to Zaid, who will just talk to you a little bit about the future of VR and what's happening in healthcare. And yeah, welcome to our first webinar and thank you for joining us.
Sure. Thanks, Leandra. Assalamu alaikum. Hello, everyone. I'm really happy to be part of this session today and thanks for attending this session. And also I'm happy to see those large number of attendees or audience. I hope you will enjoy and you will get benefit of this session. So I would like to start by sharing some fact about VR industry in general in terms of hardware and software. But let's start with the hardware first, and then we can focus more on the virtual reality or VR, ER in the healthcare market. So if you know, I mean, from hardware perspective, if you know that 10 years or 12 years ago that the VR set or devices wasn't really practical enough. I mean, the VR set were heavy, uncomfortable, expensive in terms of cost, with multiple cables, and also need external device to plug the VR set. But recently, if you know, I mean, which is really made, I mean, difficult proposition for many users. But recently, I mean, if you notice all those activities, it's become like, you know, those VR set or devices available in the market with decent budget plus advanced features. I mean, this is from the hardware perspective, and then I'm sure that you heard about all those activities from these big companies in general, from like, you know, Microsoft, Apple, so Facebook, Google, Sony, HTC, you know, with those activities recently about the heavy investment into VR, ER. So according to the Goldman Sachs, that by 2025, the market size for VR, ER market is $80 billion by 2025. So $45 billion for the hardware and $35 billion for the software. But if you, I mean, let's zoom into this VR software market, which is $35 billion. You will find that the video game market is the biggest market share by $11.6 billion. And then you'll be surprised that the second market share is for healthcare at $5.1 billion. And then the live event, video streaming, engineering, construction, real estate, and so on. But still, I mean, the market, the VR healthcare market is the second one after the video gaming. So we see that there is a significant maturity in terms of like the market ecosystem from the hardware, software, and the content as well. That's why we see a big potential in the healthcare market. So we created our own healthcare platform with the multiple application to cover some common use cases in terms of like, you know, medical skills training for doctor and student, and also patient care like a pain management and mental health treatment. Also, it's not about the platform. Also, in our platform, we have our own content management system to enable the end user, like a doctor or student, to manage the content easily without needing of programming. So we can call it zero code. So in proven reality, we believe strongly in the digital health, and we do believe that the value which will be created into, I mean, to move toward the digital economy. That's it from my side. Once again, thank you so much really for attending this session. And this is the time for my colleague, Mr. Pavel and Dr. Alex. Over to you, Pavel.
Okay, thanks Dad for the introduction. I think we are ready to move into details. And today we will cover three main cases where we can see a synergy between the technology and healthcare. It's medical skills training through the simulation. It's patient care, including the pain management and overall patient experience. And finally, we'll talk about autism therapy. So these are three main cases we're going to cover. And for this first one, I'll pass it to Dr. Alex to go into detail and show what we're doing, how we're doing, and why we're doing things. So over to you, Alex.
Okay, thank you, Pavel. So greetings to all. And one of the direction of our work is training of the medical specialists. But why do we need virtual reality? Why can't doctors or nurses learn everything from our patients? Unfortunately, during the studying in the universities or colleges, medical professionals usually cannot see the full range of pathologies and full amount of work that they will have to deal in their working places. But working with simulator dummies, which are usually quite expensive, trainees do not always feel in real conditions. But in virtual reality, we can create the most optimal conditions that resemble a real doctor office or operating room. And yet all that we need is just a virtual reality headset and a small space. We pay attention to everyone, to medical students, nurses, paramedics, general practitioners, or highly specialized doctors. And it's important for us to act from a position of evidence. Evidence-based medicine is the basis of modern healthcare. So before creating a training application, we always consult with experts who working in this field. In addition, I worked for a long time as a general practitioner and as a radiologist, and I also trained medical specialists. And I always had ideas how to make the process of education in medicine more effective and more interesting. And now, in proven reality, I watch these ideas come to life. And therefore, we can evaluate without unnecessary fantasies which specific application will work and will be useful. After creating an application, it's important for us to conduct research and evaluate whether our application actually shows results or not. For example, you can see an application for teaching auscultation. Auscultation is a manipulation of listening lungs, heart, and some other organs with help of stethoscope. In the conditions of virtual reality, we made the environment of a doctor office with a virtual patient. It can be male or female. The students can independently perform the actions necessary when listening to the lungs and heart. And of course, in the application, students have a great opportunity to hear dozens of all kinds of pathological sounds of the heart and lungs. In many cases, the sounds at the particular point will be individual, like in the real life. The teacher sees the student's actions on the monitor of the computer or at the smartphone, and the teacher can correct student. The student sees an interactive menu where they can select specific sound with help information. And the software provides the ability to work in study mode and in examination mode, in which the teacher sets the working conditions. So we make a study with aim to compare the effectiveness of lung and heart auscultation, training using traditional teaching methods like training with patients and simulator dummies, and the teaching with help of virtual reality. So the students were divided into two groups: a group of students who studied in virtual realities and in patients, and a comparison group, the students who studied without virtual technologies, who started with help of simulator dummies and mannequins and in patients. So when students listen to the control records of lung sounds immediately after the end of training, it turned out that students trained in virtual reality recognize sounds better than students trained in traditional technologies. But at the final control of the knowledge retention on auscultation of the heart and lungs, which was carried out 3 months after the end of the study of auscultation, it turned out that long-term results were significantly better in the virtual auscultation group. Note that on cardiac auscultation, the virtual reality protocol group recognized sounds more than 120% better than in control group. Even we didn't expect such outstanding results. Of course, students showed high interest and motivation when they working in virtual glasses. None of the students mentioned any significant difficulties in using the equipment. The average value of satisfaction on 10-point scale with virtual reality technologies was pretty high, 8.74. And I think you all agree that when people are interested, they will be more involved in learning. And virtual reality is amazing technology, not a surprise that students and doctors and nurses really love it. In addition, the virtual reality gives us great opportunity, not only train how to carry out manipulation, but also help to understand its meaning. For example, we can see an arrhythmia or valve dysfunction and changes of blood flow in the animated model of 3D heart and understand what creates certain auscultatory phenomena. We can also see how the sound waves are generated in different pathologies. And this will help understand what we should hear in each case. We have a wide range of application, not only auscultation. And this application for teaching various medical manipulation. There is an example of ultrasound diagnostic application. Also, virtual reality allows doctors to see organs which they are examining using ultrasound. With this great solution, it becomes easier for doctors to correlate the image on the screen and the anatomy of human organs. Or this is an example of application for endoscopic procedures. By the way, we use all real records from examination. Of course, all patient data is confidential. Doctors can also train the tactics of examining patients with various pathologies. Doctors can train how to speak with patients, find out an anamnesis, conduct a physical examination, study the data of laboratory and instrumental studies. Everything is possible. You can see, doctor can see the data of computer tomography studies, of X-ray studies, laboratory studies, everything. And of course, we pay special attention to the appearance of patients. In examining of patient, not a single detail should be overlooked. Changes can be pronounced, and in the case of cirrhosis of the liver, you can see in the down of the screen, with both the color of the screen and the configuration of the body is changed. But the changes can be not so obvious. Models of patient in our application provide a unique opportunity to differentiate even small types of rashes. For example, here you can see rash of molluscum contagiosum, different psoriasis rash, meningococcemia, and so on. With the help of our application, doctors can even upgrade their skills in dealing with emergency clinical situation. In the development of clinical scenarios, we are guided by international guidelines. For example, from the American Heart Association or from the European Society of Cardiology. But if necessary, each scenario can be adapted to the requirements of the regulatory documents of any country. So our approach is very flexible. And so let's summarize some of the main advantages of virtual reality in the training of medical specialists. It's the advantages that it needs the less physical space is required to perform the training. The content can be adjusted and expanded to meet the curriculum scope. Also enable students to participate in training room from anywhere. If student have headset in his home and he, I don't know, it's pandemia, he ill or some other conditions why he is not at the university, he also could be at the virtual university and learn everything, even the medicine. The virtual reality provides real-time feedback on the decision that student makes, and better knowledge gathering at the retention than existing tools. I gave you example at the Auscultation application. And we know that it's a lower capital investment in operation center when the persons use virtual reality technology. And now I'll give the word to the Pavel. What?
Okay, thanks, Dr. Alex, for sharing. This sounds very exciting. Then the next topic or the use case we will share is related to the patient's care, where we see lots of synergy and lots of value that we can deliver there. So first of all, let me go back. Yes, it's good to share the goals towards which we're working and what we're focusing on. There are a couple of them. First is improving the patient's experience for all the parties involved. And by parties involved, we're also meaning that as soon as we're focusing most of the time on kids, that it's not only about kids, but also somebody who's accompanied them, like parents, who are also part of this experience. Then we're also linking the psychological impact that we're doing through VR to physical data. And by doing this, we're allowing faster recovery time. And on the other side, it's not only about patients, but also about the clinical facilities, like hospitals, where we're helping to optimize the procedures to make them timely, and at the same time, lowering the usage of medicine. So these are the goals we're focusing, and going forward, we'll share a few examples how this is already done, and we see significant impact on this, and how these goals are fulfilled. But before that, I also would like to share how we're measuring what is evaluation criteria. And here we are dividing them in two big groups: subjective measurements and objective measurements. For subjective, this means that we are giving surveys for kids, for parents, for nurses, doctors, and collecting overall NPS, which of course is the data that is not is collected just from the people, right? And that's why it's subjective. But what we can also see that all in all, we're dealing with people, and our goal is to improve their experience, improve their feelings, improve how they are communicating with the facility in the healthcare. And that's why we see that this is very important to collect this part of the feedback as an addition to the data. And if we're talking about objective data, then we are measuring vital data before and after VR experience. This is not applicable for all of the cases, of course, but for some of them, this is the crucial part, and we can see already that using this experience in virtual reality, we can enhance and lower some vital signs like breath rate, heart rate, blood pressure, and this is also making a difference, and which also results in fulfilling our goals in terms of optimizing medicine usage. So this is brief on our goals and how we're measuring results. Let me deep dive into examples and real life examples, what we can see and share what the impact we're already making. So the first case is about pediatrics, and the picture you can see is already it's live picture of a pediatrician doing the examination for the young kid. So here, as we can look at the goals, we're optimizing the procedure efficiency. So the kid is from the one side is distracted, and pediatrician is doing the examination smoothly, and also pediatrician is able to control what is the exact experience of the kid and initiate the action that will help the doctor. For example, there will be a virtual character that will ask or will mimic opening the mouth that you can see right now, and kid will do the same, and then pediatrician will be happy to see this and do the examination. So this is one of the cases. Then the next case is about injections and vaccinations. So here you can see also a young lady who arrived to do a few injections, and let's say before it was a very stressful experience for everyone. And with the distraction tool where we're using VR, first of all, the patient kid is, I would not say enjoying, but is very calm and distracted to something that they like or interested, or something that is engaging them. On the other side, you can see the parents around who are also, of course, less stressed because kid is properly handled and there is nothing to be stressed about. And on the other side, as we mentioned, that there is another goal to optimize the hospital efficiency. Then you can see nurses who are doing their procedures timely and efficiently. There are also two other cases I would like to mention here. One of them is anesthesia, where we are helping kids to be transferred from the parents or from their room to the OT. So this is also quite stressful period of time where they don't know what's happening, what to see, and they see like hospital environment, which is not that fancy for them. So by this, we also helping them to be distracted, and on the other side, that affects their vital signs. And on the other side, this also affecting the amount of sedation they're taking. So we're like satisfying all the goals we're targeting. And finally, if they have less sedation, less medicines, they have faster recovery. So this is really good case where you can see lots of value added to all of the parties. But of course, all in all, this is improving the patient experience, recovery time, and the clinic efficiency. And the last thing I would like to mention here is that we're also targeting short to mid-term procedures where it's not necessarily linked to pain or something that is not that pleasant, but at the same time, this procedure should be done properly. For example, this is ECG, ultrasound, CT diagnostics, right? So here we are targeting to, once again, distract the patient to allow them to enjoy their time and do something engaging for them. On the other side, this is helping a lot nurses and doctors to set patient properly, to do the manipulation efficiently, and to complete what's needed to be done. So these are some of the examples that we can share right now with the outstanding results that we can see for all the parties involved. We have a list of procedures and cases that we are still, I would say, some of them are in the pilot, some of them on the backlog, but we see much more value that can be added also for patient care using the technology. And we are like looking forward to expand this and make sure that it can deliver to most of the cases that can be handled. And this is the big value delivered to both healthcare facilities as well to the patients. And then everyone will benefit from this. That's mainly it I wanted to share about the patient's care. Then we're going to cover the last topic for autism therapy, and I'll leave it back to Dr. Alex.
Yeah, thank you, Pavel. I want to add, yes, it's truly inspiring, especially when you see how the child instantly calms down in headset when it just screamed. It's something amazing. You are feeling how you can help in this situation. So also together with specialists in psychology, we develop application for people with special needs of neuropsychic development. For example, with autistic spectrum disorder. In working with such people, it's important that a person should start exercises with the simplest, training attention on the elementary forms, simple movements, primitive surroundings, but step by step, individually, the therapist can increase the level of complexity, gradually adapting the person to the real world. For example, here you can see an application that trains the attention and concentration for children with autistic spectrum disorder. The child must follow the ball, which can change color or in different conditions. The ball can become bigger or smaller. The room can have another colors. But at an advanced level, both the object itself and the external environment becomes more like a real condition. It can be not a ball in gray room, but a toy car in the room of the child. This application has already been tested on the 20 people with autistic spectrum disorder. There was a huge positive response, as well as observed remarkable improvements in the concentration and attention. So another direction for people with special needs in neuropsychic development includes the adaptation of people to the real world. Today we have one problem. The problem is that children with autism during the session with the psychologist under the same controlled condition, when they are comfortable, they can do everything. But then when they get to the real world, regression is often happens and the skills are lost. Therefore, we make an application that step by step, with the little complications, help children adapt to the world. For example, you can see the case of the road crossing. At the first, child will adapt to the traffic lights and will understand when it is possible to go and when it is not, and when not. Then the cars show up, then other people, the noise of the trees, signals of cars, conversation, all this can greatly influence. Or we can make the situation in the store or situation in the doctor office with the help of virtual reality, you can adapt to all of this situation. And any scenario can be adapted to a specific case and in a specific training program. This application with the road has been tested on the children with these pathologies that you can see at the screen. And interesting that we saw an admirable result. Most children repeated the skills acquired with the virtual reality headset in real environment. The fear and anxiety on the street have extremely decreased. And another plus is that parents of such children was inspired by the results, and they want to continue using virtual reality in the therapy of the child. So, as you can see, virtual reality is a great tool that can be perfectly applied in healthcare, both for training professionals and for helping patients. But like any other tools, virtual reality will give good results only in the hands of professionals who knows everything about pathology and how to work with them. And I think that we have a great team of professionals and consultants, so our application give really good results.
All right, thanks, Dr. Alex, for sharing the details about the autism therapy. I think this is the right moment where we can answer questions from the audience, if there are any. So if you have any question, it's the right moment to post this on the chat or on the Q&A so we can see and answer this. Let me review what we have so far. And yeah, I think we have time to answer these questions. All right, so the question, what devices are supported for your applications? I think I can take this one. This is pretty well versed in this. Basically, our virtuality apps are supporting any device that is on the market. If it's Oculus, if it's Pico, if it's HTC or anything else. So we're not dependent on the device, and if you have any kind of device, we can deliver, so there is no need to have several devices. So one device for one thing and another for another. So it's compatible with all kinds of devices. Then the question is in the chat, would TVR works alone with AI in the future? Of course it will. So there is no any limitation to this, and there are already few ideas that we evaluate in terms of how AI can help. And I think going forward, we'll move from procedural scenarios that were shared by Dr. Alex when you can do certain steps, and then introduce AI in terms of conversation, especially the voice conversation, to mimic what is happening in the real world. And then we might have some AI on other parts of education as well.
And I want to add that many research showed that AI wouldn't be wouldn't take a job from doctor, but it will be a great tool to helping in diagnostic and in the treatment of the different patients. Yeah, and of course, I think it will be working in collaboration with virtual reality.
All right, thanks, Alex. Then the other question I see on the Q&A is, how long did it take for research and development to build such products? I don't think I can share the exact number of efforts, or days, a month, or years it takes. But of course, as we mentioned, this depends on many factors. On the overall approach, as we mentioned, we are based on two cornerstones. One is evidence. Second is community of healthcare professionals who can help us to build this from healthcare perspective. So we're not doing this first from the technology, we're seeing where we can meet technology and healthcare. So I would say that it depends on many factors, and on the team available, on the efforts that are put there, on the quality, on many things. So as I mentioned, we are just doing everything from science approach and evidence-based, and also keeping the quality on the high end. At the same time, of course, different business perspectives and budgets, we can get different combination of these factors. And we're open also to discuss if there are any particular demands of projects. We can also discuss how to make it happen within different limitations.
Yes, I can a little bit add that it's very individually of time of research, because if it's a training program for students, they have special graphics and they make their study programs, and it can be fast. But when we speak about working with patients or working with people with autistic spectrum disorder, some of them can only put the headset on the third or fourth session, and the all therapy will need 2 or 3 months, but so it's very individual about and if we're working with training specialists or with dealing with some pathologies, there will be different months or years of the research.
All right, then the next question we have about, can you customize content for simulation training? I think we have covered this briefly, but I can also add on this that content is absolutely customizable in a way that from what you will see in terms of education specifically, like the patient's model, the data, the imaging, like for X-ray, MRI, etc., for lab data. So everything is possible. And moreover, we have a customization tool where you can go, and as mentioned in the beginning by Zaid, that we have the zero code approach where you can go put what you want to see, how you want to visualize your data and to meet your curriculum or educational curriculum, and then put it there. So this is absolutely done, and there is no extra effort needed to make sure that virtual reality education apps are adopted to particular needs.
Yes.
All right, let me see what are the other questions here. Any integration solution would be possible, hologram in the future? I think for hologram, for sure we can look into this, but we also need to understand what will be the technology there. So from software and solution perspective, we're happy to look into this, but we don't see strong hardware capabilities at this stage which can be utilized.
But at first stage, I think will be holograms that will be created with help of augmented reality, because some person said, but it's not real hologram, but something that one person could see it. And this is the way that we also will go with our applications.
Pavel, we have another question inside the chat. What are your plans for scaling into other healthcare areas beyond existing areas?
All right, of course, we have lots of things going on, and for other areas like mental health, and to be honest, not only in the healthcare, we can see where some other areas where VR can bring lots of value in terms of education and training, and do it risk-free. Also for such areas like safety training, for example, fire safety, right? So these are the areas we're also looking at. But if we're talking about healthcare, for now, this is 3 cases where there is our focus. And going forward, we're also thinking about adding value into mental health. But as you know, we have this research and evidence-based approach. So we're exactly at this stage in terms of evaluation, research, how to make it properly. Because we know that there are some solutions for some particular things, and we want to make sure that we're doing the unique product with the lots of value that is helping lots of people. So stay in touch, and of course we'll update you once we have something in this area as well.
Yes, true. I think even if we will speak about some particular healthcare fields like fundamental genetics or biochemistry, we can working not only with the patient, but with molecules, with pharmaceutical things, all what we can imagine, we can make in implement in virtual reality. I by myself see some of this application, and I believe maybe we will start working at them.
Pavel, there's a question here to ask if obviously the scalability is one of the questions, but also the same attendee wanted to know, have we actually applied these applications in hospitals and medical colleges? If you can please answer them to let you know where we have actually tried and tested our virtual reality applications?
Yeah, sure. So for adoption, yes, as we mentioned, we already did a few projects and few implementations, and there was a case study or research out of this with the very promising results and results that are showing that technology can complement existing simulation capabilities and bring much more stable knowledge gathering and knowledge retention. So this is one side. In terms of hospitals, yes, also as mentioned, for these cases that we were discussing for patients' care, this already in the hospital, in the hospitals, and for one or several cases where it's used. And we already see this like subjective data. For the objective data in terms of data collection, we will still would like to take some time to collect them and make sure that statistically they are absolutely correct. And then of course we will share them. But for subjective data, we already see lots of value added. And the last case was for ASD therapy. So this is, I think, not about hospitals or colleges, but more about private practice or therapists or centers that are working. And yeah, this is already also implemented. We can see positive outcome, but to share exact data, we will need still a bit of time to make sure that they are consistent enough so we can share with the right audience. All right, then there is a question. Is there evidence of use of virtuality in gynecology of obstetric patients? I'll leave it to Dr. Alex to handle.
One moment. In the College of Obstetric Patients, I will. So in obstetric patients.
Yes, obstetric patient gynecology.
Yes. Okay, yes. Oh, nowadays, yeah, we're working with application for gynecology and obstetrics. For example, I showed the application for making different procedures in gynecology, like hysteroscopy, and where specialists can acquire some skills how to make these procedures. Also, nowadays we have an application for ultrasound diagnostic of the prenatal ultrasound diagnostic, how to find the different pathologies in the pregnant woman or in the neonatus when the specialist making an ultrasound diagnostic. And we have in the plans to making some application how to working with a patient with gynecological pathologies, like on the examination of the gynecological examination. Yeah, so we're also working in this field.
Thanks, Dr. Alex and Pavel. I see the questions are coming in a lot here. This is really lovely to see. I hope that everybody's patient enough for us to go through all of them. There's a question here that asked a little bit, Dr. Alex, maybe you can talk about it. It's in the Q&A. So available applications or devices which helps patients with their diseases. So maybe it could be for the patient to use the virtual reality, maybe for them for patient education. Is this a possibility as well that you've seen before?
Yes, I think it's virtual reality can give to the patients a great opportunity to know some information about their body, about their physiology, and about some diseases. Nowadays we haven't such application, but if we will simplify some of the application, even application with Auscultation, we can adapt to the parents who wants to listen to their kids. I know there is some practice in the different countries where parents are taught to how to listen to their kids. I think we can adapt our application, and also we can working with application for different mental diseases because persons can have a great achievement for their mental status from the virtual reality, but all this application should be acquired with the help of a psychological consultant, and it will be like a part of the therapy, not the application for only home usage.
Thank you. That was perfect. Then we have another question here. Apart from education, where can we apply VR? Can it be helpful even in treatment or in surgery? So, have you seen anyone use virtual reality in surgery? What role can this play?
I probably can handle this one. So for treatment, as we mentioned, so our focus for now is, as we mentioned, patient care, autism therapy, and simulation training, right? So for the treatment, we can see some examples and promising examples into mental health, where it's used as a treatment, which improves your mental conditions. And for the surgery, for sure, we don't see a way to use it in a real surgery, but in terms of education, there are also examples where the VR is connected together with the haptic technology, where VR is helping you to be immersed into the environment, but haptic parts still help you to do things with your hands, which is, I believe, the crucial thing for surgery. So this is also possible. This is also something that we are looking at, but we could not share much at this moment. But this is what is possible in terms of surgery education. But in terms of actual manipulation, we don't see a way where VR will be applied.
Also, I think we looked at the application that can help to the teamwork at the surgery room, because there are surgeons, the assistant of the surgeon, different nurses, and everybody should know what they should do, what instruments to, how to use it, what the algorithm and the of the different their doings. What about teamwork? Yes, I think we can handle in virtual reality with this question. But what we need special manipulation with our hands? Yes, I think only maybe in future some haptic gloves can help us with that, but or some different haptic simulator centers, but not only the headset.
Thank you, Dr. Axel Pavel. A question was asked here if we've actually done any of the applications mentioned presently being used in the UAE or within the GCC region. Pavel, I'm not sure if you want to take that one.
Yeah, absolutely. So yes, for the applications mentioned, as I mentioned, for hospitals, for the patient's care, this is already used in the hospital. And for simulation, this was a few projects in Europe. For UAE, we're still in the pilot phase, so it's used, but we would love to share the outcomes later on once we have confirmed curriculum coverage and we have this as a part of the regular education process. So I would say yes, but there are some conditions, especially for simulation part, but related to patient's care, yes, this is absolutely used. I can see also two questions. How can we connect for collaboration? So this is exactly the slide that we're showing now. You can see these two contacts where whom you can contact in UAE or Saudi Arabia. For other countries, you can also contact any of them who you like. And what I would like to mention that as soon as we are present majorly on UAE, Saudi Arabia, and Poland, these are the locations where we can have on-site visit and discussion. For other countries, we of course can deliver demo remotely. We can discuss remotely, and then we can deliver to your device this also remotely, so you can have a look and have a try. So this is not an issue. And yeah, I think these are all questions I can see in my list.
Yep, it looks good to me as well.
Maybe there is one more question that,
hang on.
Yes, I think the question about the problems can long exposure of virtual reality cause health problems like vision problems, sickness, or seizures. Nowadays, the company Meta makes many researches of this to understood can the virtual reality be case of these problems. And as I know that the research showed that the rate of the problems from virtual reality, it's not bigger than the usage of smartphone or the usage of the television. I can say that 4 years ago, or 5 years ago, there wasn't such hardware for headset, and there was some problems with sickness because there was a little problems with the picture. But nowadays, at our research, at our practical needs, we didn't see any of the problems at the child's, even at the child's with neuropsychological problems, and at the trainees, at the students. Everybody was in good conditions, even after a long term of using of headsets.
I see that there's quite a few people that's asking how to connect. How can we request a demo? Yes, you can request a demo. Yes, you can connect. These are the email addresses at the bottom of our screen. This is what they are there for. Otherwise, scan the QR code, go to our website, go to our social media pages, and you'll be able to reach out to our business development team. Yes, the demo is for free. We're available in multiple countries. So yes, that answers hopefully that question. Reach out to us and we can definitely show you what we have. Let's see if there's nothing else. I think we can say we can bring our wonderful first webinar to a close. Thank you very much to Pavel, Dr. Alex, and to Zaid for being our panelists today. I think everybody enjoyed it. It was definitely very informative, and I look forward to our next webinar. Like we mentioned, we will be emailing the recording out to everybody who attended today, and it will also be available on our social media channels. So please make sure that you visit our pages, stay up to date with what the guys are busy with. This is honestly just the beginning. I'm truly excited of what lies ahead for Proven Reality. So thank you everyone for attending today.
Okay, thanks everyone. Have a great rest of your day and we'll be in touch.
Thank you. Thank you everyone. Have a good day. Bye-bye.
Thank you.
Thanks.
Have a great
Bye-bye.
day.
Have a good day.
Thank you. Bye-bye.